name's Jenna. I'm going to be your nurse today.
Hi.
Can I have you verify your name and date of birth for me?
Yep, it's 11/26/97 and it's Lauren Dawson.
Okay. What brings you in today?
I'm here for my annual assessment for my home.
Okay, and can you tell me where you are?
Yep, at the doctor's office.
Okay, so then that tells me that she is alert and oriented ×4. Her speech is audible and clear. Basically what I'm going to be doing in the first part is I'm going to assess your speech, your hearing, your vision, and then your memory. I have 3 words for you to remember, and you're going to have them, you repeat them to me at the end.
Okay.
It is going to be red, car, and fast.
Okay.
Alright, so for your vision, can you go ahead and read the top letters for me?
Yep, it's XCVOWA.
Alright, and I am also going to take your vital for you, which would be your pulse, your respirations, your O2 oxygen, and it would be your blood pressure, and then I'm going to take your temperature also. And those are all within normal limits. Everything is great. From there, I'm going to assess your vision. So what I'm going to do is I'm going to take my pen light and I'm going to assess your pupil dilation. Alright, and then I'm going to assess your accommodation, so I just need you to follow the tip of my pen for me, okay? Alright, and then that shows me that Perla is intact. And from there, I'm going to do a hearing test. So what I need you to do is I need you to cover one ear, and I'm going to say a word, and I'm going to need you to repeat it to me in the other when you hear it. So go ahead and cover an ear for me.
Red.
Okay.
Blue.
Okay. So that tells me that cranial nerves 1, 2, 3, 8, 9, and 10 are all intact. So before I started the assessment, I would have made sure my hands were clean and provided privacy for the patient. Now my next question for you is, have you had any problems swallowing lately? Any difficulty there?
No.
No. Okay, so what I'm going to do next is I'm going to listen to your lung sounds. But before I do that, are you in any pain? A scale from 0 to 10, 0 being none and 10 being the worst.
0.
Okay, so since the patient is in no pain, all of the swallowing, hearing, eyes, all of that and vision is intact, I'm going to go ahead on and do my respiratory assessment. So I'm going to start with your back, and I'm going to make sure that, if you don't mind to turn to the side for me a little bit, I'm going to place my hands below the scapula, and then I'm going to have you breathe in and out for me, a slow, deep breath. Alright, and you have symmetrical lung expansion. From here, I'm going to go ahead and take a couple listens to your breath sounds. What I need you to do is whenever I place the stethoscope on your back, just go ahead and take some nice deep breaths for me, okay?
Okay.
Alright, and then I'm going to move to the front, and I'm going to take the same situation, just nice deep slow breath for me, okay? Making sure I start above the clavicle area for the first 2 listens on your sounds. And making sure that I'm under the skin, under the clothes directly on the skin for these assessments. Alright, and then what I need you to do, can you raise your arm for me?
Mm-hmm.
Here I'm going to listen in a triangular motion. Just do the deep breaths again for me. Making sure, and I would have been under the clothing, right on the skin for those. so based on that assessment, I can tell that all of her lobes are clear and all quadrants bilaterally. Now, so I'm going to go ahead and listen to a few of your heart sounds. Is that okay?
Yep.
All right. So what I'm going to make sure I do is I'm going to listen with the diaphragm and the bell of the stethoscope, and make sure that I clean the stethoscope very well before I put it on your skin. Okay? Making sure to go underneath the skin for these. All right. On the right side, I'm going to go to the second intercostal space. Listen for 5 to 10 beats. Bell and diaphragm. Alright, and then moving to the left side, I'm going to do the same as the intercostal space. For the pulmonic. And then I'm moving down to the fourth intercostal space for the tricuspid. And then I'm going to move down to the fifth intercostal space for the mitral midclavicular line, making sure to use the bell and the diaphragm on both. Alright, and after listening, I can say that you're within normal limits. Your S1 and S2 are present. There's a regular rate and rhythm, and there's no murmur detected. So what I'm going to first off start is to find your brachial pulse, and to that I'm going to go up in the pinkies into the antecubital space. And then once I find those, I'm going to take the radial pulses, which are up from the thumbs. And both of those pulses are strong, and both up the upper extremities and equal. Then from there, I'm going to go ahead and test your strength. So can you go ahead and squeeze my fingers, push up on my hands, and then push down on my hands. Alright, strength is equal and strong in both upper extremities. And I'm going to take a look at your capillary refill on your fingers. And this is quick in less than 2 seconds. In both upper extremities. Alright, and then from here I'm going to move down to your lower extremities. I would first take the femoral, which is going to be here. Then I'm going to do your posterior tibial, behind. And then I'm going to take your dorsalis pedis. And then I'm going to check your capillary refills in your lower extremities and your toes. Those are also quick and less than 2 seconds. All of the pulses were strong. And now I'm going to test your strength in your feet, so can you push down on my hands? And can you pull up on my hands? Alright, and both of the lower extremities are strong and equal in their strength as well. After doing my pulses, I can say that her skin is appropriate for ethnicity, that her skin is warm, and that there is no edema present. From here, I'm going to move on to your abdomen. But just by looking at it, I can say that the abdomen is flat. I am then going to listen to your bowel sounds, starting below the belly button and going above on each side. Alright. And then I'm going to go ahead and feel your abdomen. Is that okay?
Yes.
Is there any pain?
No.
Okay. Patient has no pain, and after palpation, the abdomen is soft. So from here, what I'm going to do is I'm going to go ahead and test your balance. What I'm going to have you do is I need you to stand up. Alright, and then I need you to take about 4 to 5 steps forward, putting your one foot in front of the other, and then turn around and come back. Alright, so you can go ahead and be seated. And I would have also explained that after doing the abdomen, I would say that bowel sounds are present in all 4 quadrants. Do you mind repeating those 3 words that I asked you to remember at the beginning of the assessment?
Red car fast.
Alright, and then I would like to add that whenever I was checking her pupils, they were round and reactive to light upon inspection.